Good evening, everyone, and very warm welcome from Pacesdiaries.uk. And we are a philanthropic organization, and we are starting one more free lecture. As we promised, we are going to put in more and more free lectures for you for preparation of any part of internal medicine exam, let it be PACES, MRCP, UK, MRCP, Ireland, let it be FCPS, or let it be MD or DNB exams. This will definitely help you to one point of time. All right, so we are going to today deal exclusively on some of the pulmonary procedures in the medicine, in the general medicine. I know it's a weekday and it may be difficult time because I'm starting a little early, but I wish and I invite all of you to just be a part of it so that we can learn together. Okay, fine, fair enough. And good evening, Dr. Shantanu. And I want to unmute the very first performer, Dr. Meenam Akbar. Are you there? Dr. Vikash, are you there? Dr. Meenam Akbar, if you are there, and just say hi or hello in the chat box. Yes, I will unmute you just first. I just asked to unmute you, doctor. Please unmute yourself, Dr. Meenam Akbar.
Yes, sir.
Okay. All right. You all can invite your friends for this program. It's absolutely free. Okay. So all of you can join us for this program and we go on a philanthropic purpose. There's a 5 minutes preparation time for Dr. Meenam Akbar. This is the case. So what we're going to do is we are going to discuss a consultation case, then we are going to discuss a communication scenario, and we're going to just go through about a couple of important procedures and some guidelines regarding pulmonary medicine. All right. Okay. Here we go. 5 to 6 minutes, we will begin. And just let me know, doctor, once you are ready, we will start the session.
Sir, I can start.
You can start?
Yes, sir.
1 minute, I'll just set your timer. All the sessions are recorded, doctors, and all the sessions are available in our YouTube channel. I believe all of you know my YouTube channel, Paces Diaries. Everything is free. Everything is available in the YouTube channel. And again, this weekend, like so many people requested to do a lecture on peripheral neuropathy, we are doing. You all are most welcome to be a part of it also. Again, one CC, one communication, and theory topic discussion will be going on. Yes, doctor, please start.
Hello.
Hello, doctor.
I'm Dr. Akbar. I'm one of the doctors in the clinic today. May I confirm that you are Mr. Ryan Smith, 48 years old?
Yes, doctor, I'm Ryan Smith. I'm 48 years old.
So I'm here to discuss regarding your health condition. For that, I'll be taking your history and doing your examination. Is it fine with you?
Yes, doctor. Sure, doctor.
So may I know that what has brought you in the clinic today? Can you tell me more about it?
Yes, doctor. I'm having this shortness of breath. It's been going on for the last nearly 3 weeks. It's getting worse, doctor.
Okay. And may I know that is it the first time you are experiencing this problem, or something similar happened previously as well?
Doctor, this is the first time I'm experiencing this kind of shortness of breath, doctor. Previously, I never had this kind of shortness of breath, but first time
Hmm.
experiencing this kind of shortness of breath.
Okay, so it started suddenly or gradually?
Doctor, it just like started gradually. Like, I mean, it's not so sudden, so gradual, but in a short span of time, it has started, doctor.
Okay, and may I know that you have difficulty in breathing at rest as well, or only on exertion?
I'm having issue only when I'm breathing on exertion, doctor. At rest, it's not that problem. But again, rest also, there is some residual breathing difficulty is there, which I couldn't get over with.
Okay. May I know that do you have any cough with it as well?
I'm sorry?
Any cough?
No, yes, some cough is there.
Okay, is it a dry cough or a wet cough?
Mostly dry, sometimes where some phlegm is come.
Okay, and it is also for the similar period of 2 weeks?
3 weeks, over the period of 3 weeks.
Okay, and you are having this cough for the first time as well?
Yes. I mean, like,
Okay,
I
may I
had,
know that?
but in my life, but this is the first time I'm in having the severe cough. Yeah.
Okay. Do you feel any pain when you breathe in and out in your chest?
Feel pain when I'm breathing in and out. If I cough very much, that point of time, if I cough too much, at that point of time, I
Okay.
have some pain.
Okay. Have you coughed up blood anytime?
Yeah, sometimes, yes, I did.
What is the color of the blood? Dark, bright, any clots?
Blood is the color of the blood, doctor. Same blood color like any other blood.
Okay, and how many times it has happened during these 3 weeks?
I don't know, doctor. Whenever I
Okay,
occurs, I just feel very scared about it.
okay, don't worry. And any bleeding from any other part of your body?
Like what part of my body, doctor?
I mean, like from your nose, from your ears, from your back passage, from your waterworks?
No, doctor. No, no.
Okay, all right. Have you been experiencing any rise in body temperature?
No, doctor. Not any rise in body temperature.
Okay, have you been tired for all this time? Any fatigue?
No, I just generally feel weak and tired. I don't know because of anything. Not in a particular part of my body. In general, I feel weak and tired.
Okay, any weight changes?
There are no weight changes, doctor. My weight appears to
Okay,
be as stable as it is.
okay. Any lumps and bumps in any part of your body?
I don't think there is any lumps and bumps in any part of my body.
Any night sweats?
No, doctor.
Has anyone told you you are being pale these days?
Nobody told
Hmm?
me.
Okay. Any weather preferences?
No.
How's your appetite these days?
My appetite is fine, doctor.
Okay, all right. Have you been noticing any recent flu-like symptoms,
What is a flu-like symptom?
like any nose discharge from your nose,
No,
any sore throat?
no,
Okay, any crusting in your nose?
no.
Okay, any noisy chest?
Sometimes my chest is noisy. Not every time, but sometimes I do notice my chest is making some noise.
So, do you have any allergies, particular from dust, from birds, from like when you travel? Do you have any allergies?
I don't know, doctor.
Okay, so Mr. Ryan, may I know that is there any long-term illnesses you would like to tell me?
Long-term illnesses, like, I had this doctors told me, this lung doctors, not now, like, a year, 2 year back, they told me they found something
Mhm.
is wrong with the right side of my lung, the top and the middle part of my right side of my lung. And they said first either they thought it could be some infection, then they said it could be some, growth.
Okay, so did you get any name for the condition or any medications for that? If
Some
you like
growth,
to tell me,
the doctor, and they gave me a treatment for that.
do you remember the names of the medications?
No medication, doctor. They just cut open my lung. They took
Okay, all right.
the part of my lung. It's not,
Okay, all right.
there is no lungs there.
Okay, I'm sorry to hear about this. Any medications you have been taking you would like to show me?
I'm not taking any medication, doctor. Beyond this, they just gave me some, when I just went with the shortness of breath, I went to the GP, and the GP gave me just a medicine, like some steroid puff. He gave something, some budesonide.
Okay, so have you checked your compliance and the techniques of your steroids
Yes,
inhalers you have been taking?
it's fine, doctor. I'm taking it perfectly. There is nothing wrong with that.
Okay, okay, Mr. Ran. Any joint pain?
No,
Any skin allergies or skin rash?
not at all.
Okay, any chest pain?
No, doctor. Like I said, I only have the pain when I cough too much. I don't have any other.
Okay, any leg swelling?
No.
Any soreness in your eyes?
Soreness in my eyes, doctor. No, doctor.
Okay, any vision problem?
No vision problem.
Okay, may I ask you some personal questions?
Yes, you can go ahead and ask me.
Have you traveled recently?
Travel where? No, doctor.
Okay,
I haven't traveled anywhere recently.
okay. Do you have a regular partner?
Yes, I do.
Sorry to ask you, any casual partners?
Absolutely not.
Okay, any contact with a sick person like tuberculosis?
I don't know who is a sick person, doctor. I'm not working in the hospital, but maybe or may not be who I come across. God alone knows.
Okay. Any recent needle piercing or tattooing?
No,
Okay, all right. And any similar complaints of lung problem in the family?
in my family, I don't think so, doctor. Nobody has the problem which I'm having.
Okay, do you smoke?
Yes, doctor.
How much for how long?
Doctor, I smoke like, around 1 to 2 sticks a day now. Before that, I used to smoke around 10 to 15 sticks a day for 20 years.
Okay, so Saran, I would like to tell you that smoking in any form it's not good for your health, and I would advise you to quit smoking.
Okay, doctor, I will try my best. No, it's not
Okay,
easy. I just reduced.
okay. Any alcohol intake?
No alcohol intake, doctor.
Any party drugs? Sorry to ask you.
No party drugs, doctor.
So, what do you do for a living, and how are the symptoms affecting your daily life?
Doctor, the symptoms affecting my daily life terribly, doctor. I am just working as a carpenter, but this is like day to day, it's getting worse. Now I can't go to job. All these things are there.
I'm sorry to know about this. May I know that is it your same job for previously, or have you changed your job recently?
My job is just the same, doctor. I haven't changed my job or anything.
Okay, any recent change of environment in your home or workplace?
Recent change of environment like what, doctor?
Like any new carpeting or any sprays or any fumes, anything you have noticed?
No, doctor. Nothing like that I have noticed, doctor.
Okay. Any pets you got in your home recently or previously you had?
Bird.
Yes, birds and pets.
Why I will get a bird, doctor? I don't want any bird, doctor. No.
Okay. Okay. Right. So I would like to examine you, Mr. Yan.
Okay. 8 minutes, 24 seconds. You are starting the examination. You will have 4 minutes, 30 seconds. Okay.
Okay. So I would like to see the hands of the patient
You want
for
the hands of the patient.
like for any signs of anemia, any clubbing, any skin changes, any cyanosis in the fingers peripheral. I would
Just
like to see the,
see.
sorry.
See. What is that?
Okay. This is clubbing.
Okay. Then.
And then I would like to check for any palmar erythema in the palms,
No.
skin. Okay. Any debutant contractures in the palm.
The trains. No, doctor.
Okay. I would like to know the temperature of the patient as well,
What are the
and
given?
I'll feel it as Okay. Okay, I would like to check the face of the patient for anemia jaundice, mouth for anemia jaundice, and I would like to check the lymph nodes, anterior cervical, posterior cervical in the neck.
Nothing. No lymph nodes are there.
Okay, then I would like to check the position of the trachea, if it's central or deviated.
Trachea is completely deviated to the right.
Okay, all right. Then I would like to, I will inspect the chest, and then I would like to check for the chest expansion from the,
See, first of all, see
okay,
the right side of the chest. Is there?
okay.
Right? What is it's
This is
there?
a lateral thoracotomy scar.
Yes, this is on the right side of the chest.
Okay. So then I would like, I'll start by checking the chest expansion from the upper region to the middle.
Throughout
Sorry.
the right side. Expansion is decreased throughout on the right side.
Okay. Then I would like to percuss bilaterally for any changes in the percussion note.
Right side, it's kind of dull.
Okay. Then I would like to auscultate both lungs uh,
Right
for
side,
breath sounds or any.
some transmitted bronchial breathing there in the right side.
Okay. Then I'll ask the patient to follow the vocal resonance to say a number thrice. Then I will see if
Resonance
any
is not
changes.
significant here, doctor. It won't give you anything. Then,
Okay. All right. Then I would like to check for the sacral edema. I would like to check for the JVP. Also, I would like to palpate the P2, and then I would like to check the limbs of the patient for any pedal edema, skin changes. In the hand, I would like to offer for the bedside observations and
yeah,
pulmonary bedside
that's it. Your
spirometry.
time will be up. Can you address the concerns? 2 minutes left.
So, Mr. Ryan, what are your concerns, please?
Doctor, what on earth is happening to me, doctor? What are all these things?
So, after taking your history examination, I feel that uh, there could be some form of growth, abnormal growth
Okay.
in your lungs, which could be concerning, might be a cancer, leading to the symptoms of cough and also the blood coming in your cough as well. Could be one of the possibilities. Other than that, it could be a bug infection, which could be leading to the symptoms of cough and difficulty breathing as well. We like to do some tests in form of some blood tests, some scans of your chest as well, so that we can discuss further management plan with you.
Okay. And doctor, like my lung itself is not there, then from where infection is coming in the lung?
Mr. Ryan, your concern is quite valid. Could be a possibility that there could be some form of infection or a mass could be in the other side of your lung. So we can see and do some scans and we'll see it might be a possibility as well.
Okay. So what can be done now, doctor?
So we will be involving a team of doctors. A lung specialist will be here as well. Specialized nurses will be here as well. And we'll do some baseline tests, some scans as well. And then we'll discuss further management plan with you.
Okay. All right,
And
doctor.
we'd like to admit you as well.
You like to admit me? Okay, fine. Time's up. Can you tell me positive physical findings in this gentleman, followed by your differential diagnosis?
So in examination, I can see clubbing in
Okay.
the patient as well. And on inspection of the patient, there is a lateral thoracotomy scar
Okay.
on the right chest
Yeah.
with it on with reduced chest expansion overall on the right side. The percussion note seems to be dull as well. On auscultation, there were
Mm.
bronchial breathing is there, and I cannot comment on the vocal resonance. So, on the basis of these findings, uh, I can believe that this patient could have a lung malignancy
Lung.
previously.
So which lung malignancy, doctor? See, one side lung itself is not there. So which lung malignancy? You said you're thinking that opposite lung is now malignant.
Okay, that Okay. There could be a lung transplant as well.
What? Lung transplant? No, no, no. What you're trying to tell? Lung malignancy, which lung? The good lung is malignant or the bad lung is malignant? The lung which is not there, is there any growth is there in that empty space? So what is your second differential diagnosis, doctor?
I'm talking like I'm giving you the differential for the lateral thoracotomy scar that why it's done. But I believe that a malignancy or a kind of a bug infection could be in the other lung, in the left lung.
The left lung. Then
Yes,
next,
it could be some tuberculosis infections like tuberculosis, could be a fungal infection
in the
like
which lung, doctor?
ABP,
In the
left lung,
left lung.
left lung,
Then
left lung
three,
could be a malignancy as well.
three.
Other than that, it could be an atypical pneumonia as well, presenting like that.
Atypical pneumonia. What organism you suspect here?
Could be Klebsiella mycoplasma.
Pneumonia. Okay. So how will you investigate him now?
I would like to do investigations in form of complete blood count, kidney function test, inflammatory markers like ESR, CRP. I would like to do pulmonary function test in this patient, followed with an X-ray chest, followed with an HRCT chest. I would like to go for an arterial blood gases levels in this patient as well, and if needed, then sputum for routine examination like cytology, culture, AFB, gram stain, and gene expert. Hello.
Yes, yes, doctor. I'm listening to you.
Okay.
Okay.
Then I would like to manage my
Lung
patient by
malignancy you
doing.
are suspecting here, doctor. There are a lot of lung malignancy. Lung malignancy is like, it's a broad term. I would like to know what lung malignancy are you suspecting here in this gentleman?
Sir, squamous cell carcinoma could be one of the possibilities as the patient is a smoker.
Mm.
Mm.
Squam,
Non-small cell carcinoma. Non-small cell.
non-small carcinoma. That's
Yes, sir.
it. Okay.
Okay.
How will you treat?
Then I would like to manage my patient by doing the educational counseling explanation,
Mm-hmm.
making a multidisciplinary team,
Doctor.
which will include a pulmonologist,
Okay.
infectious disease doctor, specialized nurses. I would like to admit the patient and I would like to treat the underlying cause. If
Mm.
step up with the oxygen, if he requires anemic, then a replacement for that as well. If it's an underlying infection, I suspect like tuberculosis or any fungal infections like ABPA, then anti-tuberculosis medications or steroids. If it's an underlying malignancy, then chemoradiotherapy, or if possible, then resection of the lung mass followed with chemoradiotherapy.
Okay. All right, doctor. I'll just stop you here. Your time is up already, way back. Let me go
Yes,
back
sir.
here. What is the problem happening here? Did you ask him when he underwent the surgery? So 6 months back, he underwent a surgery. First of all, you tell me this is a lobectomy or a pneumonectomy?
There is a pneumonectomy.
Pneumonectomy.
Yes, sir.
6 months back, he underwent pneumonectomy. Now, what are all his
Mm.
complaints? Cough,
Mm.
shortness of breath, plus noisy breathing. Could be wheeze or a stridor. That guy has a clubbing. That clubbing could be already due to pre-existing malignancy or a new malignancy.
Mm.
That can be one DD.
Mm.
So a pneumonectomy patient who underwent pneumonectomy, okay, and
Mm.
he is coming back after 6 months with this complaint. Vitamin to everyone, this is not bronchopulmonary aspergillosis. No, that will not produce this kind of symptom. And aspergilloma can grow in a cavity, but not aspergillosis. And no
Mm.
mesothelioma unless and otherwise you are finding anything suggestive of mesothelioma is job or anything. Nothing is there. So it's not a
Mm.
mesothelioma. I'll tell you what is. So what is this? So what will happen to you here if you carefully see your physical examination is good, you're done, this is very well, you have done, this is done, okay, but your differential diagnosis will become borderline. So the concerns nowadays, what they are doing is, if you are not giving the right answer as the concern, right diagnosis as a concern, some people are just just taking you out and then dropping you in the borderline and concerns. Come. So you have done well. This is a tough case. This is not an easy case. This case came in UK.
Yes,
So I got this case. One of the candidate I know who attended the case and came back and he gave me all the details. So with the details, I'm just giving you the case. This is called post-pneumonectomy syndrome. This is in Pace's literature.
okay.
Okay. This is due
Yes, sir.
to extrinsic compression of distal trachea and mainstem bronchus due to mediastinal shift. Okay, this is trachea. Okay, this is left and right. Left side, this guy's lung is not there. So left side lung is not there. So there is going to be an empty space here. Right side, he is going to have a lung, for example, if you take. So the distal trachea will get compressed. And as a result of that, there is a hyperinflation occur. This is called compensatory hyperinflation. It typically occurs in right-sided pneumonectomy like this patient. The right-sided pneumonectomy. Just for an example, I'm just drawing on the left side. Wow, this syndrome is characterized by progressive dyspnea, cough, inspiratory stridor, and even mnemonic picture. So what is the treatment? Surgical repositioning of mediastinum, and the leftover space has to be filled, right? Something has to fill the leftover space. It can be filled by non-absorbable material or without or with stenting of bronchi. This is a fatal condition. If anybody is not treating it, then it is absolutely fatal. The patient can lose their life. Come here over, see the scar. This is how the scar is made. I'll post free videos on lobectomy and pneumonectomy on YouTube. Don't worry. All our videos are absolutely free. Take it and enjoy the learning. Just spread the good news, bring more people to us. Let people be blessed with free learning materials. Okay. So this is what is. So what will happen? This area will be lag, but don't worry about getting borderline in this case. You have done really well. This is a tough case. This is not an easy case. Not everyone will be able to get it. Okay. So because
Yes,
we
sir.
are discussing about lobectomy and pneumonectomy and other lung procedures, I got this case. Okay. We will go and discuss about all these things, lung transplant, everything shortly. Before that, we have a communication case and you have taken this. And I'm just waiting for Dr. Vikash. If he is there, he can take communication case. If Dr. Vikash is not here, anyone else quickly can say hi. I'll just check with him first. Dr. Vikash, are you there? Dr. Vikash, if you are there, just to say hi. Okay. Anybody else who wants to take communication case? Quickly. Quickly. Yes. Dr. Madharesh. Yes. Please welcome. Yes, doctor. I've unmuted you. Can you hear me, Dr. Madharesh?
Yes, sir.
Yes.
Yes,
Okay.
sir.
Please start preparing for this case. Doctor. 5 minutes time. Yes, yes, yes. I will come to the procedures after this. After this case over, we will see some procedures. Pneumonectomy, lobectomy, what is wax lobectomy, pneumonectomy, how the scar will be there, and some basic things about management of pneumothorax. All these things we will come to that. Don't worry about that. Okay. Any of your friends are preparing for PACES, this is a WhatsApp group. You can add them, you can ask them to be a part of it, and you guys can be a part of it. And our YouTube channel is there. It's absolutely free. And I'm not running any specific online course, just except for one-to-one sessions for very few people, no more than 5 people a month I'm taking and I'm doing. And because I don't believe in a big group and huge crowd, and I will explain about the course situation later. And then, as usual, I am now basically located between two countries, the Middle East and India. The differential diagnosis in the last case is going to be just three. One, post-pneumonectomy syndrome. Two, malignancy. There is no hemoptysis, doctor. I'm sorry if I just told it. Sometimes the blood can be streaked in sputum due to violent coughing. Profession painter is a, what do you call? There is a name for that. Forgot. Spaces use this. Mesothelioma only red herring. Yes, it's a red herring. Why not mesothelioma? Because mesothelioma is not something suddenly can occur over a period of 1 month. Already lung is operated. If there is any mesothelioma symptom, it should be there in the chronic phase. Suddenly, all of a sudden, within a month, it won't occur in the opposite lung, right? Because the opposite lung supposedly to be a healthy lung, because they would have definitely made sure, CTVS people. So next week, whatever topic you want, this week we are having a peripheral neuropathy lecture. Next week, whatever topic you want, you tell. One of our Paces Diaries member will start taking the free session for you. Whatever topic you want, you can tell. Okay. Please don't type like cardiology, neurology like that entirely. We cannot teach just 1-2 specific topics. If all of you can come to a conclusion and type, one of our members will come and teach for you. Confusion and dementia, nice topic. I'll ask him if he can do that. Or ask anyone in our team to do that. Confusion and dementia. It's going to be a challenging and a tough topic. I think we can do. We can see that. We can definitely see that. Post-renal transplant, that's simple case stuff. We'll do definitely. Don't do. Confusion and dementia is a little complicated topic. I'll ask him. If not, I have to sit for that. Post-renal transplant is easy. I'll ask them. That's not a problem. Localization in neurology. It's not something one day we can teach. It's going to be a lot. You have to divide into 3: upper limb, lower limb, cranial nerve. Again, upper motor neuron, lower motor neuron. Then again, independent nerve palsy has nerve neuropathy has to be localized. Radial nerve you need to localize. Where is the injury? The cubital fossa and the wrist or the shoulder, where it is. Underlying finding is normal. Underlying cause, he said, right? Some growth is there, malignancy. But these days they are not taking out the lungs. Our treatments are so advanced. Nobody is doing this pneumonectomy and lobectomy stuff. It's quite obsolete, this thing. But still the cases in Paces are not obsolete. They are coming. They are not obsolete. That is the thing. Saturday, we will have a similar session in peripheral neuropathy. That session will be little big because approach to peripheral neuropathy within some time I cannot do. I have to cover a lot of things for you guys, but I will cover definitely. No issues. Dr. Madresh, are you ready? You're 5 minutes over. Dr. Madresh, are you ready? Should I unmute you like again, or you got unmuted again? Doctor, can you unmute yourself now? I just requested you to unmute.
Yes, sir.
Yes, that's perfect. All right, just go ahead. 3, 2, 1, start.
Hello, my name is Dr. Magresh. Today we'll be speaking about your condition, this lung clinic.
Okay.
Am I speaking to Harleen, 31-year-old female?
Yes, doctor, I'm Harleen. I'm 31 years old.
So, Miss Harleen, today we'll be talking about the problem that you're having. Before starting our conversation, can you give me a brief idea what brings you here today?
Doctor, like I know, like it's already written in your paper, like it mentioned, like I was been told some air has entered my lung, and again, second time they said again air has entered my lung. I was first of all not understanding because lungs has air. From where, which air is entering into my lung, and all I know is like whenever these episodes happened, I had a terrible shortness of breath, and I started feeling like actually I'm going to die.
I'm so sorry to hear about this. So, Harleen, I will explain you in detail. Please
Okay.
bear with me. I'll draw in front of you. This is the lung. This is the lung, both of the lung that we have,
Mhm.
and this is the covering over the lung.
Okay.
The air that is present is inside this part, this inside part of the lung.
Okay.
While the between this lining of the lung, there is two lining of the lung. There is nothing, not air, no nothing is there.
Okay.
So what happens that a breach in this in between these two layer of the lining of the lung happens, uh,
Okay.
and the air from outside or inside may gush into this space, this potential space, the space which has actually nothing. So whenever the air is filled inside this lining, what happens, it compresses the lung, and
Okay.
that's why you are having this difficulty in breathing.
Okay.
Are you with me till now?
Yes, I am with you, doctor.
So are you now able to understand what do you
Yes,
mean, what is
yes,
meant by the lung?
I can understand, doctor. I can understand. I don't know why it is happening to me, doctor. It should happen to everyone. Why me? I don't know.
Okay. Harleen, may I know what do you do for a living?
Doctor, I'm an airline first officer.
Okay.
That is
Okay. And
my.
since how long you have been working in the airline?
I've been flying for around last for 3 years.
Okay. And have you noticed any problem before?
No, I have no problem, doctor. I'm relatively a healthy girl. I just cleared my class two medical exams for DGCI and Civil Aviation Authority, and I've been flying, and I had never had any kind of issues. But this is the first time I'm having this, and this is really scary because this is threatening.
Yes, I must really feel how you're feeling. Because it's quite a threatening condition, and anyone can have a major issue with this condition. So, what I'll suggest you right now to get admitted, and we will do some test to see why it is happening to you. Is that okay?
Just, oh my God. Okay, doctor. Why? How long should I get admitted, doctor? Because I cannot keep on taking off from work. That can get really dangerous. If I keep taking off from work, it can get turned into real danger for me. I cannot keep on taking off. I need to get a solution to this. I need to get to the bottom of it.
Yes, I can surely see that you're facing a lot of problem for this, but with this condition, and it's happening quite often, I'm afraid that you will be not able to work. You have to take leave,
So,
and if you
so I
need
will
any
be,
kind of help,
doctor, I will be not able to work means what exactly you mean, doctor? You mean I can never be able to work, or I just need to take some days off, then I can go back and fly again?
uh, first of all, we you need to take some days off, because this airline job is the pressure, as you know, when you get in the air, the pressure changes may precipitate this pneumothorax, the air inside that you're having,
Okay.
and that's why we you need to stop flying for the first for some time being, until we find the cause why it's happening, and we are able to help you with this.
Okay. So now what
Yes,
we done,
and
doctor?
yes, and I would like to know, do you take some pill, some birth control pill, anything like this?
No, doctor. I don't have any partner to take birth control pill. I'm fine. That.
Okay. So we will like you to get admitted, and we'll form a team of doctors comprising of the lung doctors, and you may need first we'll put a tube inside your chest that will help you to breathe easily, and we may also need to perform keyhole surgery, that is called VATS, that may be required to help you to to stick the lining of the lungs.
Okay.
prevent these things from further happening.
Okay.
So, are you willing to get admitted and do the needful procedures?
Oh my God. So how long it's gonna take, doctor? I just wanna, how soon I can start flying back?
See, as I said, we need to first do a scan of the chest, which is called CT scan,
Okay.
to look for any defect in the lining that you have, or uh, any ballooning inside the lung
Okay.
that can cause that may rupture and is causing these symptoms.
Okay.
And before that, I might ask you, sorry, do you smoke?
Yes, I do smoke, doctor.
How many sticks per day?
Just one or two sticks, doctor. No more than that. Just before sleep, I just smoke one stick, and just once I wake up in the morning, I just smoke one stick. Beyond that, I don't smoke.
Okay. So I might tell you that smoking in any ways, any form is injurious to your health, and in your case especially, it might be more harmful to you. So for
Okay.
that, I would ask you to stop smoking for the time being. And if you need any kind of help, we can refer to smoking cessation clinic.
I will try my best, doctor. I'll try my best to follow your advice and try to stop this.
Okay. So do you need any other information before we can proceed?
Yes, doctor. I have a couple of things to know, like, and how it is going to be. And after this, how safe is the procedure you are telling, doctor? It itself is looking very scary.
Yes, uh, even if the surgery is done, I'm afraid that you have to avoid flying duties. You may change. You can
Good
be in the
benefit.
aviation industry.
Okay.
Yes.
What do you mean by avoid flying, doctor? I may be in the without flying, what I will do in the aviation industry.
See, because when you fly, there will be pressure changes, and this pressure change can again cause the symptoms. So there are many works inside the aviation industry. We will refer you to occupational therapist, and he can help you with this. Do more some clerical jobs or any other jobs that might not involve flying,
Oh my
because flying is dangerous to you.
Oh my God, I studied hard and I worked hard and I paid a lot of money, a lot of fee to the flying school to become an airline pilot. And you're just like the telling that I cannot fly. This is unbelievable, doctor.
I'm really sorry to be the bearer of this bad news, but if you have this condition in the middle of a flight and if you are the pilot, that may risk your life and other person's life that's in the flight. So to avoid that, I would recommend you that it might be difficult, though it's not my decision to take at this point of time. We'll talk to other consultants and other lung doctor about this. But as far as I can tell you that it will be difficult for you to fly in the future.
Oh my goodness. This is absolutely scary, doctor.
Yes, I know it's quite scary that you have worked so hard for your the place that you are in today, but this can cause a problem in the future.
Oh, okay, doctor. Your time's up, doctor. Your time's up. I'll come here. I will tell you what are the things here. What you've done right, what you've done. Your welfare is fine. Concerns, you didn't ask for one concern also. When there is 2 minutes left, you have to be very specific. Everyone listening to the lecture, please be careful. And the last 2 minutes given in station 2, station 5, communication in station 1, communication in station 4, please be specifically turn to the surrogate and ask. At the last 2 minutes warning, don't tell anything, just stop everything. May know what worries you, may know what bothers you, may know what are your concerns. At least 3 concerns, try to answer to get the mark. If you don't answer any concern, this can get into trouble. This will become borderline. This will become satisfactory. What went wrong here to become borderline, the clinical judgment? I'll explain you. So how to approach this? You ask IVAP, you CK, you take it like a breaking bad news, explain the diagram. You asked about social history, personal history, smoking you asked. Also past medical history and drug history you need to ask. Already the patient is having any kind of lung disease already. That can be secondary pneumothorax. All right. I will tell you what British Thoracic Society and Civil Aviation Authority, CAA, says about pneumothorax. CAA can clear him to fly. This is the same mistake some people made in a bird fancier lung. Some guy has a bird shop, and this guy is going and telling you change the job. Is it that easy to change a job? Is it that easy to tell a guy who has a pet for years together to just throw your pet out? They will throw human beings. They won't throw pet across the world because the animals are respected more than human beings across the world. And this is becoming a pilot is not that easy. I was a flying school dropout. Now I'm trying to regain my simple private pilot license, and I have to undergo hell a lot of procedure. I just been through class 2 medicals, and class 2 medicals. Suddenly, I had some VPC. Then they stopped. Then they asked, one guy asked, I mistakenly told I took a beta blocker and came. Then they told me 1 week after washout, you come again and run the treadmill. Then I did. Then they cleared class 2. Then again, now huge things are there. So somebody becoming a pilot, getting a private pilot, then commercial pilot, then cargo pilot, then commercial pilot license. It's not that easy. It's going to be tough. So when we cannot go there and tell like, find some other job inside because nobody is going to give her any job. What job they will give? They cannot make her a cabin crew. They cannot make her a ground control lady. No, she won't. Just imagine somebody just wore all the badges and just with shoulders apart, going like a pilot and then coming back and how she will work. There is a way for her. For that, we should know the protocol of Civil Aviation Authority in both because the class 2 system is standardized across the world mostly, but Indian class 2 system is very strict. Even HbA1c, anything above 7, they will stop you. So ask about other concerns and close the conversation. So what Civil Aviation Authority says is what we are going to read. Okay, this is nothing my own thing. That is BTS and Civil Aviation Authority. Okay, they refer something as acceptable surgical treatment. Okay, thoracotomy, oversieving of blebs, parietal pleurectomy, VATS pleurectomy. Okay, these are acceptable surgical procedures, but not chemical fluorodesis. The recertification to fly, okay, recertification to fly can be undertaken 6 weeks after VATS pleurectomy. I know in and out of this because I'm an aviation student now. So unrestricted class 1, class 2 medical certification can be considered at 6 weeks. Class 2 has restricted and unrestricted. Unrestricted, you are absolutely fine. Suppose somebody's HbA1c is up and down, he is a diabetic, he is on a biotherapy. Every 3 months they will check his HbA1c. Being a pilot is not that easy. Okay. Any applicant with recurrent spontaneous pneumothorax is going to be deemed unfit. And one more thing here you didn't ask is this guy's lady's hobby. Suppose if she's doing scuba diving, that is something that has to be stopped. One. So these are pneumothorax amendments. You need not know everything here. Just remember this one here. Elective surgery can be considered for patients whom recurrence prevention is deemed important. At-risk professional divers, airline pilots, military personnel, even scuba divers also, there is a chance they can. Or somebody developed a tension pneumothorax at the first episode. All right. So they have a life to go back. And that one point got you trouble in clinical judgment. Here, the concerns you didn't ask. If you had asked the concerns, the problem would have. All right. Any doubts in this case, doctor?
I didn't mention the word concern, but I asked, do you have any more query?
Yeah, query.
Right?
I just asked about the query, and before the query, we were discussing about that. I couldn't have time to ask because that explanation went on till the end. You saw. So the explanation should be very minimal here. If she asks, can I fly back? What is going to happen? I just want you to, ma'am, I just want you to be here, get admitted here, and we will just take a admission. Also, we cannot tell now she's needing admission or not, if she's fine, because the admission and everything will be taken, dealt by the pulmonary team. So the pulmonary team, CTVS team, everyone should come together, and those people, lung doctors and lung surgeons, will see when you can do and what procedure is the best for you. I thoroughly understand you have a passion for flying. It will be really difficult for you. I'm sorry to know that, but there is a way. Let us talk to the team. Let us see what can be done. Once post the procedure, if you are deemed fit by the lung doctors, you can go back to flying. That is the truth. That is what the guidelines is. If you say that, just 20 seconds, you could have ended the conversation. Otherwise, she will keep talking something, you will keep talking something, and the conversation endlessly roll. As a result of that, the time that is needed for the concerns is slaughtered. This should be
Sir,
avoided.
will I get a warning shot in communication
Yes, I
for
said 2 minutes
you have
left.
2 minutes?
2 minutes left. The 2 minutes left. 2 minutes left is extremely important. You need not take the history, but you need to collect the relevant information here in relevant cases. For example, an MRI scan for a young lady, you should ask about allergic history. You should ask whether that lady is pregnant. That is your duty to ask. That history is something they mentioned. You cannot go ahead and ask other histories, like you have headache, you have cough, you have shortness of breath. If you are going to do that in communication, they'll fail. But this is a relevant information you should gather to give and proper management plan. That's what they expect you to do. All right. So any doubts till then? If there are no doubts, I'll go to the couple of important slides which you need to know, especially pneumonectomy, lobectomy, and pleural procedures for any internal medicine exam. Okay, that's very, very important. All right, let's go straight forward. Okay, pneumonectomy and lobectomy. Yes, pneumonectomy, symptomatic pneumothorax is admitted. This lady is not in a symptomatic situation. She had a second pneumothorax. She's coming for further management plan. She is not coming in pneumothorax in acute scenario. She's coming for further management plan. What can be done? Second episode. So, clinical examination, what are the things you will find? You can find a lateral thoracotomy scar. You can find a depression of the chest on the affected side, decreased chest expansion, trachea will be pulled out, dull percussion. If you, all these things are there, this is clinically a pneumonectomy. Lobectomy, a lobe alone is removed. So a lower or a middle lobectomy unlikely to pull the trachea. But that affected part, expansion will be reduced, dullness will be reduced, air entry will be reduced. Breath sounds will be absent. Okay. In pneumonectomy, what can happen? The tracheal pull will be there. Through the deviated trachea, bronchial breathing can be there, especially in the upper zones. So all these cases look for underlying causes, any old TB, lung carcinoma like clubbing, nicotine stains, cachexia, radiation burns, and look for any cause of bronchiectasis, because bronchiectasis, earlier they were doing this. Nowadays, we don't do those things. One. Next, one candidate asked, one doctor has asked, indications for lobectomy and pneumonectomy. Here are the indications: malignancy, a localized bronchiectasis, fungal infection, traumatic lung injury, large emphysematous bullae. We do something called bullectomy, congenital lung disease like cystic fibrosis, bronchial obstruction with a destroyed lung. These are the indications for lobectomy or a pneumonectomy. Next, this is the thing I told you. What is the difference between lobectomy and pneumonectomy? All right. This first slide will help. This entire lecture will be available on YouTube. You can go and listen to this multiple times as much as you want. This is Watts lobectomy. This is how the Watts lobectomy is done. Candidates got absolutely confused when this case has been kept somewhere. I think in Kenya or somewhere they kept. So these are the three different ports will be there. We don't know what the ports are being used for. There was a scar like this in the patient, and the trachea was pulled to that side. And there was dullness, decreased breath movement, decreased breath sounds. Complete confusion, what is going on? Because this scar was strange. Because some people ended up thinking that it could be a pleural drainage scar, but there is no stony dullness or anything. So this was a Watt scar. I wanted to show you how the scar looks like, and don't get panicked. Same way, there is some scar for robotic renal transplant. I'll show you how the scar is. Maybe some candidates ask renal transplant. I will ask the other members of Pacesdiaries to come ahead and give you a session on renal transplant that can help you. So next important thing, one last procedure, two different procedure we need to learn. One important procedure is lung transplant. What is the indication for lung transplant? Any end-stage lung disease without any alternative form of therapy. And any lung transplant patient should be less than 60 years of age. And they should have a life expectancy. So most common diseases like pulmonary fibrosis, emphysema, particularly alpha-180, bronchiectasis, cystic fibrosis, primary pulmonary hypertension, all these cases, the patients will go for a lung transplant. That's another important procedure. So what choice of lung transplant we do typically is a bilateral lung transplant is the one that is done. Okay. So indications for combined lung and heart transplant, because lung transplant case has been kept in phases. So combined lung and transplant, few indications. One is like congenital heart disease with Eisenmenger syndrome. It's one of the primary indications. Okay, you should remember. And lung transplant in pregnancy, suppose if this scenario comes, pregnancy after lung transplantation offers increased longevity in the mother, but again, organ rejection, exposure to fetus, especially teratogenic immunosuppressants, all can be very risky, so it should be avoided as per the literature. So this is the lung transplant scar. Can you all see this scar? This is a classical lung transplant scar. Again, this is a lung transplant scar. So don't get panicked if you are getting a scar. It means you are facing a case of lung transplant. So what are the complications of lung transplant? They can bring a lung transplant cases and make a case of it. Okay, immediate is hyperacute rejection, early is primary graft rejection, and pleural disease can occur in a lung transplant. Pleural effusion, pneumothorax, hemothorax, empyema, early. Acute rejection can occur less than 4 months. Again, pulmonary infections, embolism, anastomotic complications. Late complications are your fibrosis, cryptogenic organizing pneumonitis, post-transplant lymphoproliferative disorder can occur in lung transplant also, PTLD. And again, the recurrence of the primary disease which is there can recur in case of a lung transplant. So pneumothorax pathway, if they are asking, this is the latest BTS guidelines, British Thoracic Society, not the other BTS where they sing songs. So high risk pneumothorax are anyone with a hemodynamic compromise, significant hypoxia, bilateral pneumothorax, underlying lung disease, age more than 50, and hemopneumothorax. First, see, is the patient is symptomatic? Yes. If there is a high risk, immediately check if it is safe to intervene and put chest drain and other review pathway you're going to go. If the patient is symptomatic, yes, no high risk character, safe to intervene, then see. Typically, what is the patient's main priority? Procedure should be avoided, or rapid symptomatic relief, or rapid symptom relief. So in that case, you can go for a needle aspiration. If it is resolved, fine. Otherwise, discharge in OPD and okay. Rapid symptom relief is there, then again OPD review. So this is the overall view of pneumothorax. Again, if the patient's main priority, if the patient avoiding procedure, check for conservative care and regular outpatient review is they are recommended. If the patient can go for the procedure, anything symptomatic, put a needle, drain the air. That's it. This is the latest guidelines in BTS. This is the lung transplant complications, scars we have seen, and we have seen lobectomy, pneumonectomy, Watt scar we have seen, indications of lobectomy and pneumonectomy we have seen. We have seen the examination of lobectomy and pneumonectomy, what we will find, you will see. We have seen a case of pneumothorax and what is the rules for pilot as per, BTS and as well as your Civil Aviation Authority. We have seen a case of post-pneumonectomy syndrome with pneumonectomy scar. Okay, these are the common pulmonary procedures in MRCP UK patients. And I hope the session is helpful. And thank you so much for attending, everyone who's coming across from different groups. We honor you and we respect you. Like you asked a renal transplant case, we will just keep it next week we will do. This weekend I'm taking on peripheral neuropathy. You guys are most welcome to attend. Thank you so much. And if you guys need any one-to-one session or anything, you can contact me. I'm not doing any mass sessions or any group sessions or anything. You guys are most welcome. If you need any help with any kind of internal medicine exam, we are more than happy to help you and lead you. Be a part of our group, exchange the knowledge, and all the other mentors also most welcome to be a part of our group, and they can advertise their courses and anything. We are open to everything. We are here to help and help each other up. Okay. Thank you, everyone. Thank you so much. I will see you again on next coming Saturday with a session on peripheral neuropathy at 7 p.m. Thank you so much, everyone. Bye bye. God bless.